Good afternoon. Thank you for taking time out of your busy day, and welcome to our webinar on the State Family Homelessness Rankings. What do we know and what can we learn? My name is Matt Adams, Principal Policy Analyst at the Institute for Children, Poverty and Homelessness in New York City. And today I'm joined by Barbara Duffield, Director of Policy and Programs at the National Association for the Education of Homeless Children and Youth in Washington, D.C., and Carrie Byers, Policy Manager at the Ounce of Prevention Fund in Chicago. I'd like to begin with a quick overview of the next 45 minutes. For the first 20, I'll start by briefly describing the contents of our new publication, the American Almanac of Family Homelessness, and then focus on key findings from our State Family Homelessness Rankings, a unique set of 10 indicators that reflect actions that can be taken at the state level to address family homelessness, which we divided into two separate rankings. The State Education Ranking measures how well states are identifying and connecting homeless children of all ages to services, from early education for young children to financial aid for youth attending college. The State Policy Ranking examines specific policies and laws that some states have in place that can have a significant impact on the lives of homeless families, covering issues related to housing, childcare, domestic violence, and food insecurity. Then Barbara will provide context for the State Education Ranking by speaking about her work with state and federal policy and what California is doing to help homeless children succeed in school. And then Carrie will provide context for the State Policy Ranking by describing her work in strengthening child care policies for homeless families in Illinois. We will conclude the webinar with roughly 10 minutes for questions, but please ask any during the presentations in the chat box provided, and Allison Silkowski, Policy Analyst at ICPH, will respond as we go along and then moderate any additional questions at the end. First published in 2013, the American Almanac of Family Homelessness is a comprehensive policy resource for service providers, government agencies, elected officials, researchers, advocates, students, and concerned citizens across the United States who are working to find solutions to family homelessness. So what will you find in the 2015 edition? 4 main sections, starting with today's focus on the state rankings, which are new to the 2015 Almanac. Also new are the state dashboards, 1 page for each state, which replaced the state-by-state briefs in the 2013 edition. The dashboards provide a detailed summary of each state's ranking and highlight other important state trends in family homelessness, including how well parents are connected to the workforce and to social safety net benefits. By showcasing trends and statistics through straightforward graphics, the dashboard supplies stakeholders with the data they need to assess the status of family homelessness and related policies in each state. Improved in 2015 is the Ideas for Action section, which offers concrete policy priorities and recommendations that were largely informed by key findings from the state rankings. And last but not least is the issue by issue section, which has been updated and reorganized from 21 short reports in 2013 into 6 in-depth reports covering everything you need to know about family homelessness, from macroeconomic causes to its effects on parents and their children, and the public policy response to address it. At ICPH, our research uses state-by-state comparisons to better understand homeless families' experiences, to see what's consistent across states, to reveal relationships between particular states and outcomes. With the Almanac, we wanted to create a way to rank states to really draw out those comparisons and motivate action. The state rankings we developed include 10 indicators that directly relate to an action that can be taken to address family homelessness. 5 of the indicators relate to homeless children's education, from birth to college, and 5 relate to the state policy context for affordable housing, childcare, domestic violence, and food security. States are ranked from 1 to 50 on the 2 rankings, with 1 being the highest score on a given indicator and 50 being the lowest. But I want to be clear that being first doesn't mean that improvements aren't necessary, and being last doesn't mean that a bunch of changes need to be made to better serve homeless families. To emphasize this, We included where each state ranks on each of the 10 indicators and also highlighted the top-ranked state on each indicator in the full report. No state finished in the top or bottom 10 on all 10 indicators. We don't simply want to differentiate between states with robust and weak policies. We're looking for feedback and hope state and local leaders will take this information to support positive change in their communities. So jumping right in, here are the 5 indicators that make up the state education ranking, along with the national averages to help give you a sense of what they mean. Now, there's a lot of technical details that are explained in the full report, but basically, we carefully chose these 5 indicators to help measure how well homeless children of all ages are being identified and connected to important services. But why is this important? Unfortunately, no one really knows how many homeless children there are. Children in shelters are relatively easy to find, but those living doubled up or in hotels, motels are not. And families in these situations are often unaware that they are homeless and that their children have important protections and rights to help them succeed in school. So we see identifying more homeless children as a positive, not a negative. And the higher the number on each of these 5 indicators, the higher we rank the state. So again, the technical details are explained in the full report, but the second important thing to know is that we made sure that we could fairly compare states with a lot of people like New York to states that are much smaller like Maine. We also know that states have different economies and available jobs, so we accounted for that too by including poverty. We really spent a lot of time thinking about this so we could be as fair to states as possible and really get at the heart of the issue, which is to improve homeless children's access to education, not necessarily fewer homeless students. So to recap, more homeless students is not necessarily a bad thing, and the math we used here is only so we can fairly compare states. Now, as I briefly go over these indicators, I'd like you to think about them as concepts. The exact details are less important if you keep these 2 points in mind. Back in 2007, federal law made homeless children automatically eligible for early Head Start and Head Start, and states were required to identify and prioritize homeless children for enrollment. Since then, the percentage of children in early Head Start and Head Start who are homeless increased from 2.5% to 4.6% today. Much less attention has been given to improving homeless children's access to other high-quality early childhood educational programs, run mostly at the state level. So we included public pre-K programs as our second indicator. We then used 2 complementary measures to help assess how well homeless children are being identified in grades K through 12. But unfortunately, we could only find 1 for college. This is definitely not because we think that college is any less important. It's just that federal law doesn't provide even the most basic protections for homeless college students that children have in grades K through 12. No one really has any idea how many homeless college students there are. The only data collected on homeless college students is done when they apply for federal financial aid, which I'll explain more in a few minutes. All right, so here are the results of the state education ranking. This map assigns colors to states in increments of 10, with the darkest blue representing the top 10 states and the darkest gray indicating the bottom 10. Please take a moment to see where your state ranks. There aren't strong geographic patterns, but aside from last ranked Hawaii, states ranked lowest on the combined 5 education indicators are all east of the Mississippi River, with New Jersey, Pennsylvania, Rhode Island, and Connecticut ranked 46th through 49th. The highest ranked states are more dispersed, but tend to be in the western U.S., with Alaska, Oregon, Colorado, and Idaho ranked 1st through 4th. So what are some key findings from the state education rankings? Well, unlike the rankings overall, there were strong geographic patterns for the percentage of children in early Head Start and Head Start who are homeless. The 5 states that enrolled the lowest percentage were all in the southeastern U.S., while states in the Northwest enrolled homeless children at the highest rates. In terms of pre-K, we found that homeless children are under-enrolled in the majority of states, and that simply having a well-funded state pre-K program did not necessarily guarantee better access for homeless children, But having said that, the 5 lowest ranked states all lack state pre-K programs. For grades K through 12, we found that 1/4 of children living in extreme poverty, that's less than $10,000 per year for a family of 3, were also homeless. And that many states struggle with identifying homeless students living doubled up. Nationally, for every 1 student in shelter, there were 5 identified living doubled up, but 9 states identified no more than 2 to 1. And finally, in order to receive federal financial aid for college, students must submit their parents' financial information. Since this can be impossible for unaccompanied homeless youth to provide, federal law says that they can apply as independent students if they are verified as homeless and unaccompanied by either a school liaison or a HUD or Runaway and Homeless Youth Act funded shelter. However, nationwide, fewer than half of all students are verified as independent. All right, so moving on, here are the 5 indicators that make up the state policy ranking, which I promise will be much easier to explain. Overall, our goal in the state policy ranking is to highlight policies and laws that some states have in place that can have a positive impact on the lives of homeless families. The first 2 indicators relate to housing because the severe lack of affordable housing, compounded by inadequate wages, is a primary cause of family homelessness. According to data from the National Low-Income Housing Coalition, nationwide, for every 100 extremely low-income households, and that's those earning 30% or less than the median household in their local area, only 31 can access housing that is affordable to them. Second, with low levels of education and limited work histories, most homeless families only qualify for minimum wage jobs. However, for a single parent working full-time at the minimum wage, their paycheck covers less than 40% of the money needed to afford a 2-bedroom apartment. For the next 3 indicators covering childcare, domestic violence, and food insecurity, we counted the number of state policies available in each state, and the more policies, the higher we ranked a state. It's important to keep in mind that these policies don't cost more money. They just make it easier for families to access services due to the unique circumstances of homelessness. Access to childcare is critical for homeless families because without it, parents can't work or even look for jobs in the first place, let alone participate in job training or education programs. Federal child care law gives states a lot of flexibility in developing their own eligibility and other rules. So we identified 7 total policies that states have the power to implement that would reduce homeless families' barriers to accessing subsidized child care. And Carrie is going to speak more about federal child care law and her work in Illinois later in the webinar. Domestic violence is one of the main reasons why families become homeless. Families escaping their abusers are often cut off from their finances and face discrimination in the housing market. Federal law protects families in federal housing programs, but it's up to states to protect families in the private market. The National Law Center on Homelessness and Poverty identified 16 key laws that states have that can protect survivors from housing discrimination, such as allowing tenants to call the police, end leases early, and change locks, and even provide relocation and housing assistance, all of which we've included as the 4th state policy indicator. Finally, homeless families are more likely to experience food insecurity, which the USDA defines as the limited or unstable availability of enough nutritious food. Like childcare, states have the power to make it easier for homeless families to access SNAP and WIC. We found 2 federal SNAP policies and 1 for WIC that states can implement to help homeless families put food on the table in order to free up income for housing and other basic needs. All right, so here are the results of the state policy ranking. Please take a moment to see where your state ranks. Unfortunately, once again, there aren't strong geographic patterns here either, but Massachusetts, Washington, and Kentucky had the most state policies in place to help homeless families, while Wyoming, Michigan, and Hawaii had the fewest. So what are our key findings from the state policy ranking? For housing, although I want to stress that no state has enough affordable housing, but all but 3 states have fewer than 1 affordable unit available for every 2 extremely low-income families. In other words, 47 states don't have half the number of affordable units they need. And again, the minimum wage is inadequate to afford housing in every state, but in 28 states, the minimum wage covered less than half the cost necessary for a single full-time worker to afford a 2-bedroom apartment. In terms of childcare, 41 states don't prioritize homeless children for federal childcare subsidies. No state has all 7 policies that we looked at, but Massachusetts had the most with 6. And 5 states tied for having the fewest with only 1 of the 7 policies: Alaska, Idaho, Louisiana, Michigan, and Montana. For domestic violence, 33 states have 4 or fewer of the 16 key statutes that can protect survivors of domestic violence from housing discrimination and homelessness. Wisconsin had the most with 12, and Washington was second with 9. 3 states, Michigan, Tennessee, and West Virginia, didn't have any of the laws in place. And finally, for food insecurity, only 5 states, California, Massachusetts, New York, Pennsylvania, and Rhode Island, offer 2 income deductions that increase homeless and at-risk families' SNAP benefits. All right, so that's it for my quick overview of the state family homelessness rankings. Now I'd like to turn the webinar over to Barbara, who is going to speak about her work with state and federal policy and what California is doing to help homeless children succeed in school.
Good afternoon. For those of you who are not familiar with NAEYC, NAEYC is a national membership association dedicated to educational excellence for children and youth who experience homelessness. Our members work in early childhood programs, public schools, state departments of education, and community organizations to support the identification and success of homeless children and youth from early childhood through post-secondary education. Next slide, please. There we go. We are thrilled to see the emphasis on education in the Almanac. Education is a tragically overlooked component in efforts to address homelessness, and the report released today helps to shine a light on state and federal efforts to increase access and success in education. Public schools are the only universal safety net for homeless children and youth. While there is not affordable housing or a shelter bed for every child who needs one, there is a federally mandated seat in the classroom for every child who is homeless in this nation in every community. So schools are uniquely poised to identify and assist homeless children nationwide with access to basic needs and to obtain the education that's their best hope of avoiding homelessness as adults. We know that housing in and of itself will not end homelessness. As today's report shows, homelessness is complex. Childcare, healthcare, food, many different pieces have to be in place. To obtain and maintain housing, people also need well-paying jobs. And in order to obtain a job that pays a living wage, education is a must. So these next 2 bullets illustrate this point dramatically. We see that young adults with only a high school diploma earn 62% of the salary of a college graduate. And by 2018, which is just 2 years shy of the federal goal of ending family and youth homelessness, only 10% of jobs will be available to high school dropouts. 28% of jobs will be open to those with a high school degree, and the remainder will require some college education. So clearly, education is necessary in order to prevent and truly end homelessness. Next slide, please. But the first step in ensuring access to education and supports for homeless students is identification. And here, as Matt discussed, the Almanac provides information on the current status of state and local efforts to identify and enroll homeless students. Federal law, the McKinney-Vento Act, does require school district liaisons to proactively identify students who are homeless, both through school personnel and through connection to community agencies. But many challenges remain. In addition to the Almanac's findings, a recent Government Accountability Office report linked here found that school districts struggle to identify homeless students for a number of reasons. Students who are sharing the housing of others due to lack of alternatives, sometimes called doubled up, are particularly difficult to identify, yet they are often more vulnerable than students in shelters or motels. They live in unstable, often unsafe conditions. They're at great risk of physical and sexual abuse, and they're often extremely mobile without access to services. The lack of appropriate shelter space for families contributes to these hidden homeless situations, and this may be some of the reason why we see higher percentages of doubled-up students in Mississippi, while a state like Massachusetts that has a right to shelter has lower numbers of students identified in doubled-up situations. However, the greatest cause of under-identification is the low level of funding for dedicated school staff and mandatory trainings for school staff. There's a direct correlation between school districts that receive McKinney-Vento dollars and the number of homeless students identified. We saw, for example, with the ARA dollars that extra funding led to more focused attention on the identification of homeless students. And while McKinney-Vento funds have not increased in recent years, there is new flexibility within Title I, Part A, which is the largest K-12 education program, to fund the position of school district liaisons. So one thing that states and school districts can do now is review their Title I Part A homeless set-aside amounts and policies to ensure that school districts are reserving appropriate levels of funding for appropriate activities for homeless students. Turning next to items for action, there is work to be done at the state and federal level. In recent years, NACCE has become more active in state legislation with particularly successful partnerships in state houses in California, Florida, Maryland, Montana, North Carolina, Texas, and Wyoming. But I've highlighted examples of state legislation in California here as model legislation that could be replicated and adopted by other states. So we see, for example, the first laws that are listed there passed last year. SB 177 takes some of the elements of McKinney-Vento, like immediate enrollment and the requirement to post notice, and puts it in state law. And it also deems homeless students to meet residency requirements for interscholastic sports so that homeless students can participate fully in school activities. AB 1068 pupil records gives unaccompanied homeless youth age 14 and over the right to access and consent to disclose their school records. AB 1806 ensures that homeless students receive partial credit for coursework satisfactorily completed while attending another school, so they don't fall far behind in credits due to their mobility. It also exempts homeless students who changed schools in the last 2 years of high school from district-specific graduation requirements, and this will enhance chances for graduation. We know already that this has had an impact in California. AB 1733, public records, gives homeless youth the right to obtain a photo ID at no cost, and also gives homeless youth the right to obtain certified copies of their birth certificate at no cost. Legislation that's pending for post-secondary education you could see create priority for housing for homeless and foster youth, and pending legislation also would create single points of contact on college campuses in California and prioritize homeless families for childcare. Now moving on to the federal level, there are also critical policy opportunities. For the fiscal year 2016 budget, President Obama has stated that he will not sign another short-term spending bill, and is seeming more likely that there may be omnibus legislation to lift budget caps and avoid the showdowns of recent years as we head into the election. But funding for the only 2 targeted federal programs for homeless children and youth, the McKinney-Vento Education for Homeless Children and Youth Program and the Runaway for Homeless Youth Act, has remained level despite large increases in child and youth homelessness. So clearly more funding for these programs is necessary to ensure that all homeless students are identified and getting the help they need to succeed. Also, the reauthorization of the Elementary and Secondary Education Act, including the McKinney-Vento Act, is another opportunity. Right now, Congress is closer than it has been in years to finishing work on this reauthorization, and hanging in the balance of the House and Senate bills are provisions that would ensure that homeless liaisons have time and training to carry out their responsibilities, that homeless liaisons participate in professional development offered by the state, provisions to improve access to preschool programs offered by states and school districts, and many other additional changes. Congress, too, is looking to change the Higher Education Act, maybe not this year, but certainly next year, and amendments that are being considered would remove barriers to financial aid, as well as replicate and adapt the McKinney-Vento K-12 system to higher education with single points of contact on campus and plans for housing during academic break. And last, but certainly not least, The Homeless Children and Youth Act is bipartisan, bicameral legislation with over 400 national, state, and local endorsements. This legislation would make HUD homeless policy more responsive to the reality of child and youth homelessness. It would amend the HUD definition of homelessness so that school districts and other federal and child youth programs could make streamlined referrals for some of the most vulnerable families and youth who are currently excluded from HUD's definition. Moreover, it would prohibit HUD from prioritizing one group over another. Communities would be guided by their own local needs assessment and not a federally imposed priority. You can learn more about all of these initiatives at the link on the slide there, and we are very thankful to ICPH for inviting us to be a part of this webinar to showcase this comprehensive and very thought-provoking report.
Thank you, Barbara. Well, we're very grateful to have you and your expertise on this report as well. Now, Carrie is going to speak about her work in strengthening child care policies for homeless families in Illinois.
Thank you, Matt. Well, good afternoon, everyone, and thank you to ICPH for having me on today to talk about some of the work we're doing in Illinois to leverage last year's reauthorization of the Child Care and Development Block Grant to improve access to early care and education for children and families experiencing homelessness. The new law, which I'll refer to as CCDBG, improves the overall quality of child care, significantly strengthens health and safety requirements, and makes it easier for families to get and keep child care assistance. For the first time, the law also includes a number of provisions that specifically target children and families experiencing homelessness. And this has created a greater need for more resources and strategies for reaching this population, which makes today's release of the Almanac very timely. So let's take a look at what exactly CCDBG requires as it relates to homelessness. So states are now required to establish a grace period that allows children experiencing homelessness to receive child care while their families obtain any required documentation, like immunization records or birth certificates. States must also fund activities that remove barriers to enrollment in child care, including training and TA on identifying and serving homeless children and specific outreach to homeless families. And states must also collect and submit data on the number of homeless children who receive child care assistance monthly. You'll probably notice that most of these sound a lot like what is required by the education subtitle of the McKinney-Vento Homeless Assistance Act, which was intentional on the part of Congress and provides a fantastic opportunity to better integrate the policies and practices that we know work so well in the K-12 setting into early childhood programs. One other thing I wanted to mention is that the new law also establishes a 12-month eligibility redetermination period, which isn't specific to homeless families, but is one of the policies ICPH identifies in the Almanac that could reduce barriers to child care. Right now, all across the country, states are working hard to implement the law's many new requirements. All states will have to submit a state plan to the federal government in March that essentially reports how they are meeting or are planning to meet these new requirements. Child and family homelessness will probably be new to many state child care administrators, so these provisions really open the door for knowledgeable advocates like many of you out there to influence your state's child care plan by volunteering your expertise and assistance, which is exactly what my colleagues and I have done here in Illinois with some pretty good results. In Illinois, the lead agency that administers our child care program, the Department of Human Services, has been working closely with its Child Care Advisory Council to develop our state plan. I serve on that council, so I've had the opportunity to shape a set of recommendations for implementing the homelessness provisions, which I'll share with you today in hopes they might provide some ideas or inspiration for what you might be able to advocate for in your state. So Illinois has approached implementation of the homelessness provisions by first and foremost seizing opportunities to leverage existing infrastructure and resources. So because these new requirements largely represent an alignment between McKinney-Vento and childcare, we knew we could build upon what we were already doing in other parts of our K-12 and early care and education system. Schools have a lot of experience implementing the same or similar policies and procedures around identification and enrollment that CCDBG now requires. So we're planning to borrow or adapt those relevant policies and procedures currently used by our Illinois State Board of Education for our child care program. Similarly, we also plan to grow the capacity of the existing training on identifying and serving homeless children that is provided throughout the state by our McKinney-Vento lead area liaisons, instead of developing something brand new for child care providers. In order to support outreach and engagement efforts, we plan to partner with McKinney-Vento liaisons and homeless service providers who are already connected with homeless families and can identify and refer them to childcare and help them complete applications. And then finally, a major driver of quality in early care and education is something called the Quality Rating and Improvement System, or QRIS. QRIS is a system that defines quality standards at various levels and then provides incentives and supports to help early childhood programs improve their quality rating. In Illinois, our QRIS is called Accelerate Illinois. And as we move forward with CCDBG reauthorization, we are hoping to identify ways we can use Accelerate to build a larger supply of programs that are well-equipped and structured to meet the unique needs of homeless families. Next slide, please. So the remainder of our recommendations track pretty closely with the 7 child care policy recommendations included in the Almanac. You'll see here that we've also called for making children experiencing homelessness categorically eligible for our child care assistance program, exempting families from co-payments for the duration of their homelessness, providing incentives to child care providers to serve children experiencing homelessness, such as enhanced reimbursement rates or a contracted slot, establishing dedicated, flexible resources to remove barriers to enrollment and attendance in child care programs, and establishing dedicated staff that would perform McKinney-Vento-like duties in our child care resource and referral agencies. So some examples of how we envision those flexible resources being used would be for things like purchasing birth certificates or providing temporary transportation assistance if that was a particular barrier for a family. CCDBG requires that we establish a grace period for providing documentation, but it doesn't give a minimum. So we've recommended 90 days, primarily because that is what is in the proposed Head Start performance standards that were recently out for public comment, but also because we feel that any shorter time period would be pretty unreasonable for many homeless families. So given Illinois' current budget crisis, I'm not confident we'll be able to implement all of these recommendations in the immediate future, but I do expect the items that are no or low cost will be adopted in this next plan period without issue. So this would be things like the training, the policy development, grace period, and McKinney-Vento representation on our Child Care Advisory Council. And I'd also like to say that although these are still recommendations at this point and not things we're absolutely for sure implementing, for our child care community to be so willing to put forward such a progressive vision and to really embrace this opportunity to do better for children and families experiencing homelessness is a really big deal, and I think it bodes very well for the advances we'll be able to make in the coming years. So next slide. Okay, I think that's about it for me. I would encourage those of you who are looking for ways to make improvements in your state to take advantage of the opportunity presented by child care reauthorization to advocate for the kind of child care policies the Almanac outlines. This is something happening right now, and with state plans due in March, it's very important to reach out to your child care administrators ASAP if you haven't done so already. I will end here and would be happy to take any questions or comments offline as well. My contact information is listed on this last slide. So thank you again for having me, and I'll turn it back over to Matt.
Thank you, Carrie. Now we have about 11 minutes left for questions. Allison, what do you have for us?
Sure. Well, we've had some great questions coming in. One that was fairly common across everyone was whether slides would be made available. We do hope to make slides of the presentation available to all the folks on the call, as well as an archived audio recording. That way you can refer to it as you need to. A question that we got that I think would be best directed to you, Matt, is about the state policy rankings. So someone asked, why are the number of policies in the child care and food insecurity categories measured instead of measuring the effectiveness of the policies, so instead of the quantity?
Yeah, that's a great question, and I think we chose to look at access barriers and what policies could reduce those because we're limited by data at the end of the day, and so there isn't data collected that says, and I think some of it might be with the new, might be required by HUD in the continuum of care grant applications now. But we didn't really have access to good data on the number of homeless families who have access to child care subsidies. Same thing with SNAP and WIC. There are some studies, but in order to get that data, you have to file a Freedom of Information Act request through HUD, and that takes about 9 months to a year. So I think we didn't include them because we were kind of limited by data.
Great. Now, Barbara, I think I have a question for you. Someone asked if you could repeat what you were discussing about President Obama's statement regarding funding.
Sure. So as many of you watching the headlines know that we came very close to having a government shutdown because of a stalemate over the fiscal year 2016 budget. Congress did pass a short-term continuing resolution which essentially keeps funding level until December 11th. So it was a very short-term continuing resolution. And what the President has said is that he's not going to sign any more of those. The whole point of those continuing resolutions is to allow policymakers more time to negotiate new budget caps and come to a new agreement on the big picture of the budget so that we don't come to these sort of end of the fiscal year crises. And he's stated that, in other words, if Congress says, well, look, we need more time, we want another 4 weeks or another 6 weeks, he's not going to sign that. And so it puts more pressure on Congress to actually renegotiate the budget agreement from 2011, which set the budget caps, and come up with more of a global agreement, at least to get us through the next presidential election. So hopefully that provides more context.
Thanks, Barbara. Matt, someone asked about the Ideas for Action section of the Almanac. The question was whether those recommendations are state-specific or more general.
They're fairly state-specific, and a lot of them are born out of what we found in ranking states. And so we kind of separated them into 3 different categories. One is concerned with educating homeless children, basically the education policy rankings. The other pretty much covers the state policy rankings. And then we have another one that's more federal and looks at research and targeted assistance. But I'd encourage people to go out to our website and check out the Ideas for Action section. It's fairly short and pretty straightforward.
Great. Another one for you, Matt. Someone is asking about the data itself. I think this is a sort of a question about source and what was used to calculate the ranking. So the question was, how do we make sure that the data is accurate? In this person's experience, it seems like their state numbers, they seem low to this person.
Right, so that's a great question, actually. And so, accurate data is only as accurate as it is reported. And so I'm sure in a lot of cases, and I'm sure that this refers to educating homeless children and the data that's collected through schools. I'm sure in a lot of cases, students are identified as homeless but are not being reported. But I think in a lot more cases, what we found is that a lot of children are not being identified as homeless. And so in order to correct for the theoretical number of homeless children there are, we developed these 2 complementary indicators associated with K through 12. And so by looking at those and comparing your state in relation to other states, you can sort of get a better idea of how well your state is in identifying homeless children in grades K through 12. Hopefully that answers the question.
Great. This question I might pose to the group. It might be a good one for Barbara and Carrie, though. It's coming from a homeless provider, family homeless provider, who asks, what are the steps that you would recommend program staff take in order to ensure that the process of identifying or connecting to childcare, I think, does not take too long. Most of our families experiencing homelessness have long waits for childcare subsidy programs, yet there is about a 2 to 3 month wait. Any recommendations or advice on how to ameliorate or expedite that process? Maybe that's a good one for you, Carrie.
Yeah, you know, I think there are some strategies that some states have used to try to get around that. So I know the state of Virginia actually has a separate set of child care dollars that they administer through their state housing agency, and the intention there is to be able to hook families up who qualify for child care assistance immediately. So essentially the homeless service providers are able to deem the families eligible, and then they bill back the cost of child care to the state. In terms of, you know, how to do that, every state is very different in how they implement their the child care development block grant and their CCDF program. So I really think if that's kind of an issue that's top of mind, then that's what I would lead with in a conversation with the child care administrator and kind of pose that to them. And additionally, if because it's so kind of state specific, I'd also be happy to talk to anyone, take a look at your particular state context and maybe try to see where might be best to do that.
Thanks, Carrie. Someone also asked about how they can identify and contact their child care administrator.
That's a great question. So I think that there should be a list of child care administrators at the Office of Child Care, but why don't I dig up that list, and is that something we can also maybe post or provide along with the slides?
That would be great.
Okay, we'll do that.
Thanks, Carrie. There was another child care question. Someone from Ohio said that, you know, one of the challenges they face is that once a family moves out of shelter, they lose their child care until they can find employment, at least when they've exhausted their TANF benefits. The person is asking if that's the same in California or Illinois. And, you know, I do know that with the child care reauthorization, states are expected to provide child care eligibility for a 12-month period to try to eliminate some of those disruptions in care. So that's something to be looking out for as states develop their plans and fully implement the new law. Was there anything you wanted to add on that, Carrie?
No, I think that's right. 12-month eligibility redetermination periods will mean that kids, if they're eligible on day one, they'll be eligible for a full year.
Great. Barbara, if this is a question for you, someone's asking about what they can be taking to their legislators to discuss the budget issues. Are there any templates, resources that you can point them toward?
Yes, and actually it's not going to be on our website, but on one of our partners' website. The National Network for Youth has a wonderful one-stop shop fiscal year 2016 page, and on it, it has a template for for all of the targeted homeless programs: HUD's Homeless Assistance, Education for Homeless Children and Youth, Runaway and Homeless Youth Act. So it's www.nn, the number 4, the letter y.org. So nn4y.org. If you look at their fiscal year 2016 budget page, it's a really great place to go for talking points and things that you can do.
Thanks, Barbara. We are just about coming up to the end of the presentation, so I think we're going to have to close here, but thank you for all of the wonderful questions. We're going to be trying to follow up with as many as we can. There were a few that we didn't get to discuss as a group here, but if you have any additional questions for ICPH or our wonderful guests, Barbara and Carrie, please do reach out. Their contact information is on the slide here. And we thank you for joining us this afternoon.